No heartbeat in first scan of your pregnancy. What it really means. First thing is don't panic. We have to evaluate few things before you come to a conclusion. What are those few things that can give this result of no heartbeat in the first scan? First thing is we might not be dealing with the correct dates. We don't know when you got pregnant. So if you think you missed your period and come after a week or two for a scan, you might be earlier than what you think. So predicting ovulation is something that we are still not able to do correctly unless you are getting scans throughout your cycle. So if you have conceived naturally, there is always a potential that there could be a misinterpretation or miscalculation of the dates. So if we repeat a scan after 1-2 weeks, generally that comes to a clearer picture. So don't panic. The second thing what can happen is maybe we are scanning you very early when we don't expect to see the heartbeat. Usually heartbeat of the baby will come when you are roughly 7 weeks pregnant. This is calculated from last period if your periods are correct and if you fall pregnant at the expected dates. So there is some measurements that we also see, like what is the baby pole has formed or not and what is the measurement of the baby pole. So if it's very early, then that is the reason why we are still not able to see the heartbeat in the pregnancy sac. The next possible reason is how is the equipment? Maybe you are taking a scan when the scan machine is not very optimal, or an internal scan. Instead of having an internal scan, if you are scanning from tummy, then we see a little later. So always an internal scan with a good equipment, we can identify the heartbeat little earlier in early pregnancy scans. So watch out for all these before we conclude that this is a problem and there is no heartbeat. So generally 1 to 2 weeks later after your first scan, we will repeat the scan to see the measurements again, and only later we can come to the conclusion.